Okay, so we talked a little bit about viruses and viral replication. And now we're just going to talk a little slice of epidemiology. So just to define some terms, an infection occurs when an invading organism is able to reproduce in or on the body's tissues. So in the case of a virus, it's invaded the tissues that it's specific for, like the lungs or the upper respiratory tract, and it's reproducing and making new viruses, which stinks. So a sporadic infection is an infection in a single individual. Endemic is continuous transmission within a population. So a lot of our cold and flu viruses, or cold viruses particularly, are endemic within a population. They're always sort of lurking about, mutating, waiting to get us later, but they're not widespread. An epidemic is a higher than normal transmission or spread to a new geographical area. So the increase in the number of influenza cases in the wintertime, that is more of an epidemic, where you get a higher than normal transmission, and then it goes back down. A pandemic is where transmission has occurred on most continents. And if you're like most of us, you've been checking out those maps and looking at things and seeing things on the news, we have a pandemic going on. So transmission of the COVID-19 virus has occurred on most continents. One website that I've been looking at a lot recently is called Worldometer, WORLDOMETER, and they're tracking the total number of cases in the world, including mildly affected, seriously affected, deaths, and people that have recovered, and then they have reportings for all different countries. It's a really nice place where the information is all boiled down if you want to follow that. If it stresses you out, then please do not. Another good source of information for your local infection rates, the Washington State Department of Health has really good information on their website, and that they update it daily. The number of negative tests, which I find comforting, the number of new positives, and any other changes that are going on. And it breaks it down by county on the Washington State Health Department website. So that's kind of nice. So how do we transmit infectious agents? If we know how it's done, we can kind of know what we can do to affect the transmission, decrease it, hopefully. So this is what's a graphic of what's called the chain of infection. So it starts with an infectious agent. And there's transmission from person to person usually. You have to have a reservoir, and the reservoir is the source of infection. So it's either a person with an active infection or a person who's asymptomatic but is still producing the virus. Okay, so that is the reservoir. A person can be a carrier. A carrier is someone who never develops the disease but is still giving off viral output, or a person with subclinical signs of the disease. So with COVID-19, they're saying that the incubation period for the virus from when you first contact it till when it develops into symptoms is anywhere from 2 to 14 days. So between 2 to 14 days, maybe you don't have any signs or subclinical signs, you're not sick yet, but you can still transmit the disease. So you're a carrier once that's happened. So that's one of the reasons why they're talking about people that have been exposed to someone who has COVID-19 are people at risk, and they're also people at risk for transmitting the infection. So if you are a reservoir, for some things, like for bacteria, it could be an environmental source such as contaminated soil. For a virus, it's always an infected person or animal. So the person may carry the disease agent and show no signs of the disease if they're in that subclinical period, or they may show signs and symptoms of the disease. So you need a portal of exit, a means whereby the agent leaves the reservoir. And there are lots of different modes of transmission, which we'll talk about. With COVID-19, the mode of transmission is droplet transmission. It leaves the body on droplets of respiratory fluid from sneezing and coughing. That's droplet transmission. So for other disease agents, it could be air, it could be water, it could be direct contact, like bloodborne pathogens, it's often direct contact, or food. With COVID-19, droplet transmission is the mode of transmission, and we'll talk about how droplet transmission works. So the portal of entry is access to the new host. So with a respiratory virus like COVID-19, the portal of access is your eyes, nose, or mouth. That's why you need to wash your hands and don't touch your face. Because with droplet transmission, so here's this guy sneezing, you can see those little droplets shooting out of his mouth. The reason that most sensible people are trying to use social distancing now to decrease the transmission of this virus is because the droplets fly out about 3 or 4 feet and then hang in the air for not very long, and then they drop down to the ground or to the surface that the person just sneezed on. So if you're standing right next to someone when they sneeze within that 3 to 4 feet, you could inhale the airborne droplets. That is one way to get it in droplet transmission. The second way to get it is the person sneezes on their hand and then touches you, and then, and shakes hands with you, and then you touch your face and it gets in through your eyes, nose, and mouth that way. Or they sneeze on a surface, you touch that surface and you touch your eyes, nose, or mouth, and it gets in that way. So the way we're going to break the chain of transmission, the link in the chain here is we're going to stay 6 feet away from people. So we're not in danger of their droplets flying on us. We're going to wash our hands frequently, and we're going to disinfect surfaces, and we're going to assume that surfaces are infected unless we just disinfected it. So if you touch something, don't touch your eyes, nose, or mouth. Don't touch your face. So that's really how we're going to break this. So stay away from people far enough away that you're not going to inhale their sneezed or coughed droplets, and don't touch stuff. Wash your hands with soap and water. Soap and water is the most effective thing to wash your hands with. If you don't have access to soap and water, use hand sanitizer with at least 60% alcohol. And then the next time you are close to a sink, wash your hands. So I cannot stress that enough. In fact, turn off the lecture right now and go wash your hands, and then come back and start. You also want to disinfect surfaces that you come in contact with at least once a day when you're at home, more frequently when you're out in public. So the way that we're going to slow the transmission and flatten the curve and not overwhelm the healthcare system is we are going to stay out of droplet range, and we're not going to touch our face when we're outside. Of course, you're home. The first thing you should do when you get home is wash your hands with soap and water for at least 20 seconds. And right after you washed your hands with soap and water for at least 20 seconds, you can touch your face then. But don't do it when you're out in public. And that includes adjusting your glasses. That's something I do a lot. Fixing your hair, putting on lip balm, all that stuff that we do all the time, we're going to have to break that habit. Okay? So once you have the problem with the COVID-19 virus is it's new. None of us have immunity to it. And there's not been enough research to know clearly is if someone after getting it is still immune to it. So normally once you've gotten something, you've developed antibodies towards it, you recover from it, you're then immune to that. But we don't know if that's the case with COVID-19. It might be mutating fast enough that we don't develop immunity to it. So, but health status is important. You've probably heard that people with compromised immune systems, older people or people with medical comorbidities, are more susceptible to getting sick from the virus. So health status is important. Immunity, none of us have it, so you could cross that off the list, but with other pathogens, that is part of it. Age, people who are older are more susceptible to COVID-19. However, that doesn't mean that people who are younger aren't dying from it, because they are. Nutrition and health status in general is something that's going to make you less susceptible. But because that immunity factor is out for a novel virus, we're fighting an unknown enemy at this point. So infectious agents can be transmitted a lot of different ways. Bacteria through blood and injuries, from animals, from sexual contact, from ingestion of different things. With COVID-19, it's the oral and nasal secretions that maybe get to your hands or get to other things that you touch that go in either inhaled or by touching your face or mouth. So so we're sort of in this chart, we're in the upper left-hand side of it for COVID-19, but all those other things can be transmission sources for other pathogens. So it's not thought at this point that it's vector-borne in any way, so you don't get it from insects, and you're not going to get it from petting your dog or cat. Unless somebody with COVID-19 sneezed on your dog and cat, and then you pet it, get the droplets on your hands, and then touch your face. So keep that social distancing with your dog as well. So droplet transmission is those respiratory or salivary secretions that are expelled by sneezing or coughing from an infected individual. Aerosol transmission involves small particles from the respiratory tract that are suspended in air and can travel farther than droplets. Okay, so this is not a normal transmission for COVID-19, but it can be aerosolized and then it hangs in the air a little bit longer. So what happened at Life Care Center in Kirkland in the Seattle area is the elderly people that were living there were showing up with pneumonia systems. They gave them nebulizer treatments. The nebulizer treatments aerosolized the COVID-19, and so more people got it because it was suspended in the air. So unless you aerosolize it, though, the particles are not going to be suspended in the air. So that's not a normal, it's a low incidence transmission. It just turned out really bad for Life Care Center in Kirkland. But it's not aerosolized by normal respiratory or salivary secretions. So droplet transmission or fomite transmission, where you touch something with droplets, that's the normal transmission mode for COVID-19. It's vector-borne is where an insect or an animal is the immediate host, and that is not the path of transmission for COVID-19. It is for other things, though. Like malaria, that's a classic insect-borne disease. So factors that decrease host resistance, age, pregnancy, genetic susceptibility, immunodeficiency, malnutrition, chronic disease, severe physical or emotional stress. And how many of us are not in severe emotional stress right now? Inflammation or trauma, and impaired inflammatory responses. So some people, that's the thing, is you might say, well, I'm young, I'm healthy, I'm not going to get it, or if I do, it's going to be mild. But you could make other people sick. You can make other people sick that are more or have decreased resistance. So we have to protect each other. So we have to go on the idea that we are already infected and we don't want to infect other people. If you think of it that way, it changes how you do everything. So pathogenicity is the capability of a microbe to cause disease. And virulence is the degree of pathogenicity. So is it invasive? Is it a toxin? Does the bacteria often adhere to receptor sites? And the ability to avoid host defenses. So COVID-19 is very virulent because we don't have defenses against it. It's a new virus, so our immune systems have never met it before. Newly emerging diseases, that's COVID-19, is a newly emerging disease. It's an antigenically different form of a common infection. And so it spreads beyond normal endemic areas, and that's what we've seen it do. When it comes to bacteria, multi-drug resistant bacteria can cause problems as well, and we will discuss that in pathophysiology. So infection control requires two approaches. Standard precautions used in all settings with all clients when body fluids may be exchanged. That means when you are working in the clinic, you need to protect yourself and your patients. Special precautions might be for someone diagnosed with a particular infection, used in addition to standard precautions. So someone with TB, they might have them in a special isolation, airborne particle isolation, that sort of thing. But standard precautions is all clients in all settings. Assume people are infected and act accordingly. That's important. So how do we break the chain of the infection cycle? So with the reservoir, reducing the numbers of people that we contact, that is one way to break the chain. That's our social distancing. We're reducing the numbers of people that we are in close enough contact with to inhale their droplets or touch their droplets. The exit, if we put up barriers on the exit, so if someone is sick, they need to wear a mask. A mask is not necessarily going to prevent you from getting the disease, but it's going to prevent someone who has it from transmitting it. Covering up their mouth and nose, it's a barrier to releasing those droplets. So with transmission, for COVID-19, we're talking about indirect respiratory droplet on hands or surfaces. And so hand washing, disinfecting, and sterilizing things is the way we're going to break the chain for this. So wash your hands. The CDC recommends for household cleaning 80 milliliters or a third of a cup of bleach in a gallon of water, or 20 milliliters or 4 teaspoons of bleach in a quart of water to sanitize surfaces. When you bring your groceries home from the store, I'm disinfecting the outside of all the containers and everything I get. So wash your hands, disinfect stuff. With direct transmission, barriers like gloves, glasses, gowns, and safe waste disposal can break the chain there. Current immunization is not available for COVID-19, so we can't use that to break that thing. We have to use the other things, reducing the numbers of people that we are in contact with. Barriers, a mask on a person who's sick. If you're caring for someone who's sick, they should wear a mask. Hand washing and disinfecting in order to reduce that respiratory droplet on hands or surfaces. The susceptible host, that incubation period is 2 to 14 days. It's thought, it's not known for sure, for COVID-19 results in the disease. So once you have the disease, you become a reservoir. And so to break the chain, reduce the number of people that you come in contact with. If you have any symptoms, stay home. Of course, I think everybody's staying home now. So there you go. Hopefully we can break this chain. So you can locate and remove or isolate the reservoir infection. That's what we're doing with social distancing. You can identify and restrict access to contaminated food or water. That one doesn't really apply to COVID-19, but there you go in a case where that's it. You can reduce contact between infected persons and the remainder of the population. That's a big one for COVID-19. Blocking portals of exit and entry. That's a big one. If you are sick, wear a mask. Remove or stay away from people. Removing or blocking modes of transmission. So if you stay far enough distance away from people, that is removing a mode of transmission, and that's what we want to do. Reducing host susceptibility by immunizations, adequate nutrition, and access to healthcare is very important, but we don't have immunizations available for COVID-19. So remember all these things you can do to break the cycle.